Tidelands is growing. We are the biggest employer in Georgetown County, but we're getting really ready to expand even further north and a little bit to the west. We've got plans to build a new hospital. We've got plans to just grow all over the place. We expect our growth to potentially double in size over the next 5 to 10 years. And that's to meet the needs of the community. So there's so many people that are moving into the area, so many needs in the community, so many things that we try to fill in those gaps and take care of all those people. And so that's our main mission. We are recruiting in a couple of different areas. The one area is within students, so really focused on our student program. We are finding that through our really robust program that we've put together in the last few years, about 30% of our openings that we fill annually come from that student program. Horry Georgetown Technical College has been a huge partner. We've been involved with them for years and years, and they just continue to get creative with us as we see needs, we talk to them. We've been really involved with this new concept called P2P, which is Pathways to Possibilities. And that is a focus on every 8th grader in the several county radius. And the reason it's 8th graders is there's been a lot of studies that say 8th grade is when kids start to think about their careers. And so there's pathways and all the systems come together. We're not recruiting as Tidelands Health, we're coming together as health systems and explaining to these students, if you want to be an accountant, you can do that in the health system. If you want to be a mechanic, if you want to be a nurse, if you want to draw blood, there's a lot of different opportunities. And so that is getting a lot of 8th graders now thinking about, oh, health science may be the way that I want to go. There's jobs available in the area. I mean, we have openings just about in every job that you could imagine, but I would say the tech, anything with tech tied to it is big. We need to find people that have the cybersecurity skill set. We need to find people that have the ability to just help us with our hardware needs. I mean, there's so many needs within the IT space.
My role here is a network administrator. I work with all kinds of network equipment like routers, switches, access points, all the stuff that gets everybody connected in the hospitals, and even in your home you have that stuff. I haven't always been interested in tech and IT. I didn't really know what I wanted to do. After I got out of high school, I went to a bunch of different colleges to look around and see what there was, and then I stumbled upon HETC, Horry Georgetown Technical College, and they had lots of good programs, mainly networking, and then they came out with the cybersecurity associate's degree, so I went and got both of those degrees. I didn't really know where to go. I was looking around for all kinds of jobs. One of my professors reached out to me about an opportunity here at Tidelands, and so I sent my resume in, and I had an interview, and here I am. All the equipment that I work with will, like the workstations, they'll connect to the switches, and that's how they get internet access. So in my role, a lot of the medical devices will have to connect to the network, and they have to be able to send data to where it needs to go. When the nurse goes in to see the patient, and they take some reading off of them, and they have to send that data. That's going over the network, so we're helping to facilitate that connection. I think the doctors and nursing staff, they realize that the IT staff is really important, or else they wouldn't be able to do what they're doing now. And so that definitely makes me feel important, and especially all my coworkers, I'm sure they feel the same way. Because without the doctors and nurses, we wouldn't have a hospital. Without the IT staff, we wouldn't have a hospital either. So I think we're all pretty equally important around here.
It's a chance to give back to the community. It is an inherent opportunity to take care of somebody. It is looking at your neighbors and knowing if something happens, they're going to be okay. You don't get that in other industries. I mean, you might make balance sheets, you might build a car. Those are all really awesome things. But in healthcare, you're talking about people's lives, and you're talking about families' lives, and that's the key. To me, I think that's the biggest thing that is the compelling argument for kids and really anybody to come into healthcare, is that you're going to really make a difference, and you're going to be paid well. There's going to be jobs. There's a lot of job security in healthcare. We're always going to need healthcare. but it's a chance to just take care of somebody. And I mean, that's what it's all about.